Prolozone. Ozone, an amazing molecule made of 3 oxygens. Ozone enhances circulation, it improves tissue oxygenation and healing. Ozone has literally been used in medicine for over 50 years, primarily in Europe, for pain. Because of ozone's amazing ability to oxygenate and heal the body, it can be injected into arthritic and damaged knees, shoulders, elbows, hands and wrists, the spine, cervical, thoracic, and lumbar, and the pelvis, as well as hips, and even the TMJ can also be successfully treated with Prolozone.
When I was a kid, if I bent over the wrong way, I couldn't stand up, somebody had to pick me back up again. I did some physical therapy, and then over the years, I've done a lot of work in every arena that I could. It's just always there. And there's always a low-grade pain, has always been a low-grade pain there. When you were doing the ultrasound guidance, of course I could feel the needle moving, and I mean the ultrasound, as you said, okay, now just over a little bit, I mean I could feel, okay, you're right precisely on it. I mean it was just exactly on the core of where the challenge was, right at the same instant. It's like, okay, you're right. Well, when you were doing the actual injection, I could feel the pinch of the needle. And it was a pretty small needle, I think, because it was very slight. And the actual injection itself, I could feel slight pressure on the spot where I could tell the tip of the needle was, but then there was no pain to it or anything else. And immediately getting up, I mean, my spine felt better, easier to flex and move, so it's awesome.
Yeah, and you had it.
I hope we can do a couple of other spots.
Yeah, and you had it in your foot as well.
Yeah, there's a spot in my foot, and I've been doing work with my body and structure for 45 years since I started to become conscious and aware. And there had always been a spot right in the center of the bottom of my foot that it was never painful, but there was always just a tension point, that there was a stress point. That I've done everything. I mean, I do everything I can get my hands on to heal, and nothing had ever moved that. And so when we did the ozone injection in it, it's probably, in terms of if I shift my awareness to it, and the sensation of the tension that was always there, the tension's maybe 20% of what it has been since I started to become aware of it, so 40 plus years.
Yeah.
So, I'm ready to go for 2 other places in my body that have had some long-term trauma that I've been able to work with, but not, finish. So I get the sense that they'll finish with the ozone in it. So yeah, if there's pain, obviously putting the oxygen in is really powerful. And it seems like when we did the foot, that was what, Monday. I think it was Monday, so today's Thursday. And so 4 days ago, and it seems like the effect wasn't just temporary. I know the oxygen that you injected is now gone from that site, but the site has changed. So, I'm delighted to be ready to do a couple of other spots on my body that I've been working on. It's like I'm ready.
Properly diagnose, as well as to ensure accuracy, all of our injections are done under guided ultrasound. To schedule a consultation for Prolozone, give us a call or email me at askdrjl@gmail.com. And remember, if healing is possible, consider it to be within your reach. Bye for now.